Peak procedure, the oral examination. The oral examination is divided into 7 subgroups: the lips and vermilion border, oral cavity and mucosal surfaces, underlying structures of lips and cheeks, floor of the mouth, salivary gland function, tongue, palate, tonsils, and oropharynx. Compression technique. Correct palpation technique is critical to the success of the oral examination. The primary palpation technique used during the oral examination is compression of the soft tissue between the examiner's fingers. Subgroup 1. Lips and vermilion border. The oral examination begins with a visual inspection of the lips and vermilion border. Subgroup 2. Oral cavity and mucosal surfaces. Visually inspect the entire oral cavity and oropharynx. Look for any conditions that would cause the examination to be modified or postponed, such as a herpetic lesion or a red, inflamed throat. Next, visually inspect the labial mucosa, beginning with the lower lip. Place your index fingers on the inside with your thumbs on the outside of the lower lip. Evert and retract the lip fully away from the teeth and alveolar ridge. Retract the lip completely so that you have a clear view of the entire labial mucosal surface and the vestibule of the lower lip. Now, inspect the upper lip. Slide both index fingers upward and use your thumbs to evert and retract the upper lip. Stretch the tissue away from the dental arches and visually inspect the entire mucosal surface. Next, inspect the buccal mucosa on the right side of the mouth near the maxillary arch. Place your index fingers on the inside with your thumbs on the outside of the cheek. Evert the cheek and stretch the tissue up and away from the maxillary teeth. Extend the tissue completely away from the teeth so that no folds remain to conceal a lesion or abnormality. Slide your fingers down toward the mandible. Stretch the tissue down and away from the mandibular arch. Be sure to extend the tissue completely so that no folds remain to conceal a notable finding. Subgroup 3. Underlying structures of the lips and cheeks. Subgroup 3 involves palpation of the lips and cheeks, beginning with the lower lip. Palpate the lower lip by compressing the tissues between your index fingers and thumbs. After palpating the lower lip, reposition your left hand with the middle and ring fingers extraorally on the right cheek. These fingers are not wet with saliva, and your patient will appreciate this courtesy. Reposition your right index finger opposite the fingers of your left hand. Compress the tissues of the right cheek between your fingers, palpating the entire length of the buccal mucosa. Now, reposition your fingers for the upper lip. Palpate from the right commissure of the mouth to the left. Finally, palpate the left cheek. Compress the tissues between your fingers, covering the entire length of the buccal mucosa. Subgroup 4. Floor of the mouth. Begin subgroup 4 by inspecting the anterior region of the floor of the mouth. Ask the patient to touch the tip of her tongue to the roof of her mouth. The inspection will be easier if the patient is in a chin-down position. A mouth mirror may be helpful in providing indirect illumination. Next, inspect the posterior region of the floor of the mouth. Ask your patient to assist you by relaxing her tongue and protruding it slightly. Fold a damp gauze square in half and grasp the tip of the tongue between the sides of the square. Use your right hand to pull the tongue gently toward the left commissure. Using your left hand to apply gentle pressure upward against the submandibular gland makes it easier to see the floor of the mouth. Carefully inspect the right side. Repeat this procedure for the left side of the mouth. Last, palpate the floor of the mouth. Place your right index finger on the floor of the mouth. Position the middle and ring fingers of your left hand under the patient's chin. Ask the patient to relax her tongue and close slightly. Gently move the tongue out of the way with your index finger. Palpate the floor of the mouth by pressing upward with your extraoral fingers and downward with your index finger as if you are trying to make your fingers meet. Palpate from the right posterior region forward to the anterior region and then back to the left posterior region of the floor of the mouth. Subgroup 5, Salivary Gland Function. Begin your examination of the salivary glands with the submandibular gland. Ask the patient to raise her tongue toward the roof of her mouth to evaluate saliva flow from the sublingual ducts. Use a gauze square to gently dry the area around the sublingual caruncles and sublingual fold. Press down gently with a cotton-tipped applicator in the region of the caruncles. A drop or stream of saliva should be evident if the gland is functioning properly. Next, evaluate the functioning of the right parotid gland. Ask your patient to open her mouth halfway so that her cheek is easy to retract. Locate the parotid papilla on the buccal mucosa opposite to the maxillary right molars. Dry the papilla with a gauze square, as it will be difficult to detect saliva flowing out of the papilla if the area is wet. Using the tip of a cotton-tipped applicator, press the area slightly above the parotid papilla. Roll the tip from an area slightly above the papilla down to the papilla while applying gentle pressure. Repeat this rolling action several times as necessary. If the duct is functioning properly, a drop of saliva will be expressed from the papilla. Evaluate the parotid gland on the left side using the same technique. Subgroup 6, Tongue. Begin your examination of the tongue by inspecting the ventral surface. Ask the patient to open wide and touch the tip of her tongue to the roof of the mouth. Closely inspect the ventral surface of the tongue. Keep in mind that the tongue is a frequent site of oral cancer. Next, inspect the dorsal surface of the tongue. Ask the patient to relax her tongue and protrude it slightly from the mouth. Remember that you want to examine the entire dorsal surface and tip of the tongue. So take a minute to inspect the tip and anterior portion of the tongue at this point. For the next portion of the inspection, a damp gauze square is used to assist you in holding the slippery tongue. A common error is to wrap the gauze around the body of the tongue. All this wrapping is time-consuming and covers too much of the tongue surface, inhibiting inspection. An easier and more effective technique is to fold the gauze square over the tip of the tongue. Once the gauze is in place, gently pull the tongue forward. Care should be taken not to injure the lingual frenum of the tongue on the incisal edges of the mandibular anterior teeth. Visually inspect the dorsal surface of the tongue. Use a mouth mirror to view the posterior portion of the tongue. Next, inspect the right lateral border of the tongue. Gently pull the tip of the tongue to the left commissure. Evert the tongue slightly to obtain a clear view of the lateral surface and foliate papillae. Visually inspect the entire lateral surface. Use a mirror to view the posterior portion of the lateral border. Repeat this procedure to inspect the left border of the tongue. Now that the visual inspection is complete, palpate the tongue. Gently compress the body of the tongue between your index finger and thumb. Be alert for swellings or nodules. Subgroup 7. Palate, tonsils, and oropharynx. Begin subgroup 7 with a preliminary visual inspection of the palate. Visually inspect the hard and soft palate. Next, palpate the hard and soft palate. Avoid sliding your finger across the palate, as this technique may cause the patient to gag. Instead, palpate an area, then lift your index finger away from the palate to reposition it. This approach to palpation is much more comfortable for the patient. Finally, inspect the tonsils and oropharynx. You will need a mouth mirror to move the tongue out of your line of vision. Position the mouth mirror with the reflecting surface down. Ask the patient to say "ah" as you depress the back of the tongue downward and forward. Moderate pressure is needed to keep the tongue out of your line of vision. Visually inspect the tonsils and oropharynx. The oral examination is a physical examination technique consisting of a systematic examination of the lips and vermilion border, oral cavity and mucosal surfaces, underlying structures of the lips and cheeks, floor of the mouth, salivary gland function, tongue, palate, tonsils, and oropharynx.